Hello viewers, welcome to my YouTube channel Set to Care You Online Nursing Channel. I am Madhu, nursing professional. So today's video is all about AIIMS Nursing Officer Exam 2018 expected questions from old question papers. Moving to our first question, a nurse is caring for a patient with myasthenia gravis. Which of the following nursing diagnoses is a priority which need immediate intervention? Option A. High risk for injury related to muscle weakness. Option B. Ineffective coping related to illness. Option C. Ineffective airway clearance related to muscle weakness. And option D. Pain related to muscle weakness. You guys have 10 seconds. Please guess the right answer among these four. First, read the question carefully and understand it. Identify the right answer, and the right answer is ineffective airway clearance related to muscle weakness. Ineffective airway clearance is a priority nursing diagnosis which needs immediate intervention by a nurse. Weakness of a respiratory muscle decreases airflow, causing a gradual decline in vital capacity, making breathing and clearing the airway through cough difficult. Moving to second question, which of the following symptoms is a early diagnosis of myasthenia gravis? Option A, dysphagia. Option B, fatigue improving in the evening. Option C, ptosis. Option D, respiratory distress. Please do read the question carefully. Symptoms in early diagnosis of myasthenia gravis: dysphagia, fatigue, ptosis, respiratory distress. Please identify the right answer. There is a right answer among four, and the right answer is ptosis. In more than half of the people who develop myasthenia gravis, their first signs and symptoms involve eye problems such as drooping of one or both eyelids, that is ptosis, double vision, that is diplopia, which may be horizontal or vertical, improves when or resolves one eye is closed. Hope you guys understand the rationale carefully. Question 3. An adult male has undergone spinal surgery. Which of the following intervention is appropriate for the client? Option A. Assess the client's feet for sensation and circulation. Option B. Encourage client to drink plenty of fluids. Option C. Log roll the client to prone position. And option D. Observe the client's bowel movements and voiding patterns. Please read the question carefully and identify the right answer among these. The right answer is assess the client feet for sensation and circulation. Rationale about it is assess the client's feet first for any alteration in sensation and circulation. Altered sensation and circulation indicates damage to spinal cord. If these occur, notify the physician immediately. Moving to fourth question, which of the following is not a neurotransmitter? Option A, cortisone. Option B, acetylcholine. Option C, epinephrine. Option D, norepinephrine. Please do read the question. Is not a neurotransmitter. Cortisone, acetylcholine, epinephrine, norepinephrine. You guys have 10 seconds. Please do guess the right answer. Read the question carefully. We are asking about is not a neurotransmitter. There is a right answer among four. Please do think. And here we are with the right answer, that is option A, Cortisone. Cortisone is a steroid that is glucocorticoid while others function as a neurotransmitters. And in the question we are asking about is not a neurotransmitter. Moving to fifth question, flapping hand tremors is seen in which of the following conditions? Option A, uremic syndrome. Option B, chronic renal failure. Option C, hepatic encephalopathy. And option D, all of the above. Guys, you have 10 seconds. Please read the question carefully. Flapping hand tremors is seen in which of the following conditions? Uremic syndrome, chronic renal failure, hepatic encephalopathy, and all of the above. Please guess the right answer. And the right answer is all of the above. This involves three of the conditions: uremic syndrome, chronic renal failure, and hepatic encephalopathy. Asterixis flapping tremors or lever flap is a tremor of the hand when the wrist is extended, sometimes said to resemble a bird flapping its wings. Chronic renal failure and hepatic encephalopathy results in uremia, that is uremic syndrome. Moving to sixth question, a 35-year-old male client has undergone spinal anesthesia. The nurse should immediately position the client in which of the following position? Here are with the option. Option A, flat in a supine position. Option B, left lateral position. Option C, prone position with head turned to the side. Option D, knee chest position. Please read the question carefully and understand it. Don't be hectic while reading the question. Calmly read the question and understand it. So, here we are with the right answer, that is option A, flat in a supine position. Because the client should be kept in a flat in a supine position for approximately 4 to 12 hours post-operatively to prevent complications of a painful spinal headache. Leakage of CSF from the puncture site is believed to be the cause of headaches. By keeping the client in supine position, pressure of CSF is equalized, which prevents trauma to the neurons. Do read the rationale again and understand it carefully. Moving to seventh question, medical management of increased intracranial pressure, abbreviated as ICP, includes option A, administer half-strength saline, option B, administer mannitol, option C, reduce the number of breaths in the ventilators, and option D, administer plasma volume expanders. Read the question. Medical management of increased ICP includes what? Saline, mannitol, number of breath decreases in the ventilators, and plasma volume expanders. So guys, please read the question and identify the right answer among four. So the right answer for medical management of increased ICP is option B, administer mannitol. Mannitol is administered for the drainage of cerebrospinal fluid. Sedation will also help to reduce the increased ICP. Moving to eighth question, which of the following diagnostic investigation is useful to detect seizures? Option C, CT scan, that is computed topography. Option B, EEG, that is electroencephalography. And option C, X-ray Option D, MRI scan, that is magnetic resonance imaging scanning. So guys, please identify the right answer. Diagnostic investigation to detect seizures. CT scan, EEG, X-ray and MRI scan. Please do brainstorming. Identify the right answer. It is easy, and the right answer is EEG, that is electroencephalography. Electroencephalography is a test that detects electrical activity of brain electrodes attached to scalp. EEG is more often used to diagnose epilepsy, which causes obvious abnormalities in EEG findings. Moving to ninth question, degenerative neurological disorders include which of the following? Option A, Huntington's disease. Option B, osteomalacia. Option C, Paget's disease. Option D, glioma. Please read the question carefully. Degenerative neurological disorders include what? Huntington disease, osteomalacia, Paget's disease, or glioma. Do read the question carefully, calmly. Don't be hectic while reading the question. First understand it, then identify the right answer. The right answer is option A, Huntington's disease. How? Huntington's disease is a chronic progressive degenerative neurological hereditary disease of nervous system that results in involuntary choreiform movement and a dementia. Moving to 10th question, a 23-year-old client is admitted with tonic-clonic seizures. The nurse knows that most common cause of tonic-clonic seizures for this group is option A, electrolyte balance, option B, stroke, option C, head trauma, option D, congenital defect in brain. Read the question again. Client is admitted with tonic-clonic seizures. The nurse knows that most common cause of tonic-clonic seizures for this group is option A, electrolyte balance, option B, stroke, option C, head trauma, option D, congenital defect in brain. Please do identify the right answer, and the right answer is option C, head trauma. Head injury is the most common known cause in young adults. For middle-aged individuals, stroke, tumors, and injuries are more frequent catalysts. In people aged 65 years above, stroke is the most common cause, followed by degenerative conditions such as Alzheimer's disease. Please read the rationales very carefully to understand the exact fact and the reasons behind the questions. Moving to 11th question, which of the following term refers to weakness of both legs and lower part of the trunk? Option A, paraplegia, option B, hemiplegia, option C, quadriparesis, option D, tetraplegia. Please do think right direction. Identify the right option among four. Read the question again. If you don't understand in once, then do again read the question. And the right answer is option C, quadriparesis. Paraparesis, that is paraplegia, refers to partial or complete loss of voluntary motor function in the pelvic limbs. Similar involvement of all four limbs is termed as tetraparesis, that is tetraplegia. Of quadriparesis, quadriplegia, hemiplegia refers to paralysis of one side of the body. Moving to 12th question, Which of the following ECG findings indicates hypokalemia? Option A, tented T wave. Option B, ST segment depression. Option C, prolonged PR interval. Option D, widening of QRS complex. Read the question again. Following ECG changes indicate hypokalemia: tented T wave, ST segment depression, prolonged PR interval, and widening of QRS complex. And the right answer among these is ST segment depression. How? During hypokalemia, we can note ST segment depression. Moving to question 13. An assessment specific to safe administration of IV mannitol is option A, vital signs, option B, hourly urine output, option C, weighing daily, option D, level of consciousness. An assessment specific to safe administration of IV mannitol, guys. It is about the IV mannitol. The assessment about vital signs, hourly urine output, weighing daily, and level of consciousness. What you have to assess the first, if patient is administering IV mannitol, and the right answer is option B, hourly urine output, because mannitol is an osmotic diuretic which increases the urine excretion. Hence, urine output must be carefully monitored early to prevent any fluid imbalance. Moving to question 14. Which of the following is the most important assessment during the acute stage of an unconscious patient? Option A, coherence and sense of hearing. Option B, level of awareness and response to brain. Option C, pupillary reflexes and response to sensory stimuli. Option D, patency of airway and adequacy of respiration. Please do read the question carefully again and again and understand the meaning, what the examiner is trying to asking you, and identify the right option among them. And the right option is option D, patency of airway and adequacy of respiration. Checking airway, breathing, and circulation is the priority assessment for the unconscious patient. Moving to question 15, inability to speak or understand the spoken word is known as agnosia, aphasia, apraxia, or insomnia. Guys, please notify inability to speak or understand the spoken word is known as what? Option A, agnosia, option B, aphasia, option C, apraxia, and option D, insomnia. Please do identify the right option among four, and the right answer is aphasia. Inability to understand or produce speech as a result of brain damage is called as aphasia. Agnosia means inability to interpret sensations. Apraxia is a motor disorder, and insomnia refers to sleep disturbances. Please read the rationales carefully to understand the exact meaning, and the reason behind the answer is what. Hope you guys like the video, and thanks for watching our videos. If you guys like our videos, please do subscribe our channel, Sat to Care You Online Nursing channel. Like and share and comment in the video comment section. Thank you.